Hello, I'm Dr. Valerie Walker, and I'll be your host for this episode of The Medical Moment. And today we're going to be talking about anorexia, as it's commonly called, or anorexia nervosa, nervosa indicating the functional or non-organic component of this disorder. So let me ask you something. When you look in the mirror, you grab the mirror, and you look at yourself, how do you see yourself? Do you see yourself as thin? Do you see yourself as fat? Do you see yourself as ugly? Just how do you see yourself when you look in the mirror? Well, the problem with anorexia is that when these patients look in the mirror, they see themselves as fat. They have a distorted body image of themselves, and I don't care what their weight is, their weight can get all the way down to 60 or 70, but guess what? They see themselves as being overweight. Anorexia, the cause is unknown. There's just a lot of things in healthcare. We don't know what causes it, and all we're trying to do our best right now is keep the research going on everything and to find proper treatments. But for now, the cause of anorexia nervosa is unknown. We know things that are associated with it, and we're going to talk about that a little later in the broadcast. But what we do know about it is that patients with anorexia have a refusal to eat enough food to maintain a normal body weight. A lot of this comes when they have like a predisposing post-traumatic illness, something bad happens to them. You can see it surface, but a lot of times it just happens for no reason at all. In anorexia nervosa, which is one of the eating disorders, and we're going to do a lot of the eating disorders. We're going to do bulimia, where patients eat food, big, huge volumes of food, and throw it up, and then they burn their throat and get a thing called esophagitis, where all that acid is burning their throat. And then guess what, ladies? We're not going to forget overweight and eating also. But today, and for today's purposes, we're still going to stick with anorexia nervosa. So these patients see themselves as fat. Even though they look in the mirror and they can, like I said, can weigh just a little bit, they have a refusal to eat. So a lot of times patients ask me, they say, well, is the hungry instinct there? Do they feel hungry? Well, yeah, they feel hungry. That doesn't make the instinct go away. But what happens with patients with anorexia, they tend to not acknowledge that hunger instinct, because that gives them an element of satisfaction to say they got control over that too. So that's why the hunger is there, but they still will not eat. They will not even eat if they see their health going down. And I know you've seen the stories on the Dr. Phil show where he's featured these twins. I've had anorexic patients in my practice, and one girl told me one time had severe anorexia and her mother was overweight, and she said, Dr. Walker, I just don't want to get overweight like my mother. And I'm going, you're not going to get overweight like your mother if you just continue to eat a healthy, balanced diet and exercise and do those type of things. And eventually she got better, but her whole thing was, well, I think it started with a divorce. When her parents got divorced and her mother was overweight, she associated her mother's weight with the divorce. So she figured, if I ever want to get married and not get divorced, then I need to keep my weight down. So I think that's what triggered hers. But the biggest thing is that not only do they not eat, they restrict the foods that they do eat. And even when they do eat, I have patients that will eat only one thing, and we're going to do a show on that too. They'll eat like just French fries or just a piece of bread, just one little thing, because they want to keep that weight down. I have supermodels who I see, and the thing that they eat all day, the whole time they're on that shoot, they have lettuce, like big heads of lettuce, and they just break them open and just sprinkle a little lemon pepper on it, and that's what they eat all day long, and drink a lot of water, and sometimes smoke cigarettes, because cigarettes sometimes can take the appetite away, and that's not a good thing either. So the first thing we know about anorexia in the patients is that they food restrict themselves, and they have a poor image of their body, just a poor image of how they look, and they don't look anything like what they look like, they think they look like in the mirror. Some of the risk factors for, here we go again, we're going to always come back to it, is family history. There's always a genetic component, and actually we found out even in identical twins that have anorexia nervosa, identical twins are different from fraternal twins. So we know with everything, it's going to be a family contribution. It's going to be a genetic contribution. We just don't know exactly how that happens. We also know it happens in high paid and athletes. You know, athletes who have to stay thin to do what they're doing. We see that a lot. And a lot of times they suffer from amenorrhea, meaning they don't even have their periods. They starve themselves so bad they don't even have their menses. So we see it there a lot also. We see it in modeling. Like I said, in some of my models, they only eat lettuce all day long. Just lettuce with lemon pepper sprinkled on the side. Actually, lettuce with lemon pepper sprinkled on the side is actually good, but it's not something that you just want to eat all day long. So these are the types of things we see in athletes and all. And what's some of the complications that we're looking at when we have patients with anorexia nervosa? Well, first of all, the bones can get very, very thin. Osteoporosis, and this is bad for the dancers with anorexia nervosa because you need nice, strong bones, especially if you're doing ballet and all these things to do these type of dances. But you see it. One of our most popular dancers, Paula Abdul, she had more bulimia, and she acknowledges that, trying to help other young people to get past this, where you vomit the food up that you eat. But I think a lot of times, and I think research going to show, a lot of times these conditions kind of overlap each other, that you can have one sometime and one another, and they just sometimes overlap. So the osteoporosis, or the bones get thin, and we're talking about young women. So now no menses, the bones are getting thin, and then infertility. These people have a hard time bearing children because the whole human body is just off base because it doesn't have any nutrition. The human body has to have all the minerals and the vitamins and the protein and all the things it needs to make it go. And when you're starving yourself every day because you looking in the mirror and all you see is this heavy set person, this poor body image that you're looking at and not eating, then that is going to have a toll on the human body. The big other thing you can have is heart damage. A lot of the things that I've noticed you see in patients with anorexia who are not eating are some of the same things that we see in people that overeat. And that's another disorder that we're going to talk about too, is overeating and obesity. You can have problems with your heart being damaged, with your lungs being damaged. A lot of times because the liver is damaged, you start retaining a whole lot of fluid that you cannot get rid of, and that's bad too. A lot of fatigue. You're very, very tired. Gastrointestinal problems with stomach and acid and all the things that go along with you not eating and starving the human body and taking it through all those different phases actually of starvation. That's basically what you're doing. It's breaking down all the reserve it has. The body will reserve things, but when you start starving, it starts breaking down all the things it needs because the human body wants you to survive. It wants to do everything to keep you alive. So it starts breaking down things, and then you get thinner and thinner and thinner. So not a good thing. So the muscles begin to get real weak. You actually lose muscle mass with anorexia too. The muscles are not strong anymore. They start getting weak, and actually 5% of all anorexics over a 10-year period, they die. Because one thing that we see too that we have to be very cognizant of in our anorexic patients is suicide. So you got to stay close on top of these patients. You got to get them the help they need. And so you say, what is the help they need? Well, the first thing we have to do is do the differential. Like I always say on this show, we have to find out what is not. It's a diagnosis of exclusion. and let's find out what it's not. We have to check things like your thyroid, always your thyroid, because this is responsible for a lot of metabolism. So you'll hear that word come up a lot on this show. Is always get that thyroid checked. You have to make sure they don't have this thing called body dysmorphic syndrome. And this is a syndrome where people look at themselves and they see a body part they think is flawed and something wrong with it, and they zero in on it. And you cannot get them off of it. It could be they think they got ugly feet and they don't want to wear sandals or anything because they just have zeroed in on the fact that they have these ugly feet, and that's the way they're going to roll. So we have to pay attention to that. Inflammatory bowel disease, when patients start having with anorexia problems with their bowels, we have to make sure it's not any of the things like ulcerative colitis, Crohn's disease. So there again, all of these are diagnoses of exclusions. And the biggest one too for weight loss, you know what that is cancer. When people start losing weight, the first thing you say, do you have cancer? And in the country where I come from, my grandmother and them used to call cancer the consumption. They said, do you have a consumption when you start losing a whole lot of weight? So always we have to rule out and make sure you get these patients to a doctor, because they got to find out what is not before we say what it really is. And lastly, what is the treatment? How do we treat this? How do we get these people back on track to eating good? Well, the first thing we have to do is identify the behaviors that are driving them to do this. And like I told you earlier, a lot of the things that drive patients to do this is some big catastrophic event that occurs in their life. And when that happens, these type of tendencies tend to pop up. So we need to not only address it to find out what it is, but we need to address this thing. They probably may need therapy. You know, they're gonna need a good psychiatrist to try to talk them through it. And the biggest thing is, if it's really bad and the electrolytes and all these things are all out of whack and the potassium is just low and everything is going bad, we may have to put you in the hospital to try to get you back to your normal weight. And you probably will have therapy and counseling and all that while you're in the hospital, and try to get you better so that we can let you know and you can learn that being at your ideal body weight is not a bad thing. So what is ideal body weight? Again, anorexia comes in mild, moderate, and severe. For mild, we usually say greater than 17. For moderate, about 16 to 17 for that body mass index, that BMI. You've heard your doctor ask you about your BMI. And then when it's severe, it's less than 15. So you know we're in a little bit of trouble when that BMI drops less than 15. So let's be cognizant of these things. Let's watch people that's losing weight and doesn't seem to have no other apparent reason for it. That's why we say it's functional, meaning non-organic cause of this weight loss. And let's just give them the care that they need. Let's be a loving, supporting family and get them to the right institution who can give some help. I'm Dr. Valerie Walker, and this has been the Medical Moment on Anorexia Nervosa.